Yes, we are. Very good afternoon, everyone. Thanks for joining today's session. Our today's guest speaker is Dr. Alka Jha. She is a senior consultant from the Fortis Hospital, Vasant, Kunj. She has done her MBBS from the Lady Harding Hospital, New Delhi, and then she moved to Safdarjung Hospital, for where she graduated for the internal medicine. She is working in a endocrinology department since last 1 decade. So over to you, Dr. Alka Jha, and thanks for the joining in.
Thank you for the kind introduction. Good afternoon, everyone there. Today I'm going to talk about on diabetes and the myths and realities associated with this diabetes. तो हम मेन टॉपिक पे जाएं डायबिटीज उससे पहले लेट्स कलेक्ट सम इंफॉर्मेशन अबाउट द डायबिटीज। डायबिटीज होती क्या है? इसमें स्लाइड्स आर विजिबल। तो डायबिटीज एक ऐसी कंडीशन है जब हमारे शरीर में एक ब्लड शुगर की वैल्यूज जो है एक सेट अमाउंट से ज़्यादा होती है। जैसे हम खाली पेट आइडली हमारे बॉडी में शुगर जो है लेस देन 100 रहना चाहिए और खाना खाने के बाद 140 से नीचे रहना चाहिए, लेकिन जब ये वैल्यूज इससे ऊपर चली जाती हैं तो इसको बॉर्डर लाइन डायबिटीज, प्री डायबिटीज या डायबिटीज कहते हैं। बेसिकली एक हार्मोन होता है हमारे शरीर में जो जब खाना खाते हैं उसके बाद जो हमारे ब्लड में शुगर बढ़ता है उसको कंट्रोल करने के लिए जरूरत होती है। किसी कारण अगर ये हार्मोन हमारा नहीं बने या ये हार्मोन काम ना करे, जिसको हम इंसुलिन रेजिस्टेंस भी बोलते हैं, हमारे ब्लड में जो शुगर है वो अंदर सेल्स के अंदर नहीं जा पाती है, जिसकी वजह से ब्लड में शुगर की वैल्यूज बढ़ जाती है। कई डिफरेंट टाइप्स की डायबिटीज होती हैं जिसमें 3 मेन हैं जिनको हम बोलते हैं टाइप 1 डायबिटीज, टाइप 2 डायबिटीज एंड जेस्टेशनल डायबिटीज। टाइप 1 डायबिटीज अक्सर बच्चों में होती है। इस कंडीशन में इंसुलिन हमारे बॉडी में बनना बंद हो जाता है, जिसकी वजह से हमें इंसुलिन बाहर से देना पड़ता है टू कंट्रोल द शुगर। टाइप 2 डायबिटीज आजकल ये बेसिकली मोटे लोगों में होती है जिनमें इंसुलिन किसी कारण से काम नहीं कर रहा था। बॉडी आपकी इंसुलिन बना तो रही होती है लेकिन उसका वर्किंग काम नहीं कर रही होती, जिसकी वजह से ब्लड में शुगर की मात्रा बढ़ जाती है। शुरुआती स्टेज में ये अक्सर हमें अडल्ट एज में मिलती थी, बट आजकल क्योंकि मोटापा छोटे बच्चों को भी ग्रस्त कर रहा है, छोटे बच्चे भी उस मोटापे से अफेक्टेड रहते हैं, तो ये आजकल हमें टाइप 2 डायबिटीज बच्चों में भी दिखाई देती है। तो बच्चों में दोनों ही प्रकार की डायबिटीज होती है, टाइप 1 एंड टाइप 2। तीसरी मुख्य प्रकार की डायबिटीज है जेस्टेशनल डायबिटीज। जेस्टेशनल डायबिटीज एक ऐसी सिचुएशन है जब डायबिटीज हमारी प्रेगनेंसी के दौरान पकड़ी जाती है, यानी कि उससे प्रेगनेंसी से पहले महिला को डायबिटीज नहीं थी लेकिन ड्यूरिंग प्रेगनेंसी उसके ब्लड शुगर्स बढ़ने लगे, तो इस प्रकार की डायबिटीज को हम जेस्टेशनल डायबिटीज कहते हैं। तो ये 3 प्रकार की डायबिटीज हैं। हम जो आज बात करेंगे प्राइमरीली टाइप 2 डायबिटीज की। एक सिचुएशन होती है जिसे हम बोलते हैं प्री डायबिटीज। ये क्या है? इस कंडीशन में हमारे ब्लड में शुगर बड़े होते हैं लेकिन वो इतने नहीं बड़े होते हैं कि वो डायबिटीज की रेंज में आए, नॉर्मल भी नहीं है, इतने हाई भी नहीं है कि इसको हम डायबिटीज बोल सके। तो इन दोनों कंडीशन के बीच में, नॉर्मल और डायबिटीज के बीच की जो सिचुएशन होती है उसको प्री डायबिटीज बोली जाती है, यानी कि आपके शुगर स्लाइटली बड़े हैं और आगे संभावना है कि आप एक फुल ब्लोन डायबिटीज को डेवलप कर ले आने वाले कुछ समय के अंदर। इसमें या तो आपके ब्लड शुगर, फास्टिंग ब्लड शुगर हाई हो सकता है, और कई मरीजों में फास्टिंग शुगर हाई होता है लेकिन खाना खाने के बाद शुगर की मात्रा बढ़ जाती है। तो अगर आपकी वैल्यूज ब्लड शुगर की 140 और 199 के बीच में है खाना खाने के बाद, तो इसको हम इम्पेयर्ड ग्लूकोज टॉलरेंस बोलते हैं। और अगर आपकी फास्टिंग शुगर जो है 100 से 125 के बीच में है, आइडली 100 से नीचे होनी चाहिए, 126 से ऊपर हो तो हम डायबिटीज बोलते हैं, इन दोनों के बीच में हो तो हम इसको प्री डायबिटीज बोलते हैं। प्री डायबिटीज को भी जानना और उसको सही सही तरीके से मैनेज करना जरूरी होता है, क्योंकि ये एक ऐसी सिचुएशन है बहुत ही स्विफ्टली फ्यू मंथ्स, फ्यू इयर्स, अगर हम अपना हेल्दी लाइफस्टाइल नहीं रखते हैं, डायबिटीज में कन्वर्ट हो सकती है। गुड पॉइंट ये है कि इस कंडीशन को अगर हम अप्रोप्रिएट तरीके से मैनेज करें, लाइफस्टाइल के जरिए या कोई डाइट फॉलो करके हम इसको कंट्रोल करें, वेट अपना रिड्यूस कर लें, डेली वॉक करें, तो इस प्री डायबिटीज से हम नॉर्मल ब्लड शुगर्स में भी जा सकते हैं। इसलिए प्री डायबिटीज को इग्नोर नहीं करना है और प्री डायबिटीज की मैनेजमेंट जैसे हम डायबिटीज की करते हैं सेम तरीके से करनी है। अक्सर इस कंडीशन में टैबलेट्स की रिक्वायरमेंट नहीं आती है, बट कई बार आपके डॉक्टर्स इस कंडीशन में भी टैबलेट्स एडवाइस कर सकते हैं, निर्भर करता है उस मरीज के बाकी के पैरामीटर्स कैसे। मूविंग फर्दर, कौन किन लोगों में डायबिटीज होने की संभावना, रिस्क ज्यादा रहता है? सो आइडली अगर हमें इन जनरल बात करूं तो हमारी जो एथनिसिटी है, एशियन एथनिसिटी, हम एज सच ही हाई रिस्क हैं फॉर डेवलपिंग डायबिटीज एज कंपेयर टू द वाइट ककेशियन पॉपुलेशन। इसलिए हम लोगों को अपने लाइफस्टाइल, अपने वेट पर शुरुआत से ही कंट्रोल रखना है, शुरुआत से ही अपनी हेल्दी लाइफस्टाइल को फॉलो करना है, क्योंकि हम बिकॉज हमारी एथनिसिटी जो है उसके चलते हमारा डायबिटीज डेवलप करने का रिस्क ज्यादा है एज कंपेयर टू द वेस्टर्न। गाइडलाइंस कहती हैं कि जैसे ही आपकी एज 30 ईयर से ऊपर होती है, आपको हर साल एक बार अपना शुगर का टेस्ट जरूरी कराना है, बिकॉज 30 ईयर के बाद द रिस्क ऑफ डायबिटीज गोज अप। स्पेशली अगर आपके फैमिली हिस्ट्री में डायबिटीज है, आप भी एक रिस्क पर हैं डायबिटीज के लिए। अगर आपको मोटापा है या ओवरवेट कैटेगरी में है, सिडेंट्री लाइफस्टाइल है, 12 घंटे चेयर पे बैठने वाला काम, यू आर एट रिस्क फॉर डेवलपिंग डायबिटीज। जिन महिलाओं में कि प्रेगनेंसी के दौरान जिन्होंने एक ऐसे बच्चे को जन्म दिया है जिनका वजन ज्यादा है, या जब आप पैदा हुए थे तो आपका वजन 4 किलो से ज्यादा था, तो चांसेस हैं कि आपको आगे जाके डायबिटीज होने की संभावना ज्यादा हो एज कम्पेयर टू जिनका बर्थ वेट नॉर्मल हो। तो बर्थ वेट भी एक आजकल बहुत इंपॉर्टेंट पैरामीटर है टू डिफाइन द रिस्क फॉर डायबिटीज। लास्टली, अगर आपके कोलेस्ट्रॉल पैरामीटर्स डिरेंज है, लो एचडीएल है, एचडीएल एक गुड कोलेस्ट्रॉल होता है, तो अगर उसकी मात्रा कम है, ट्राइग्लिसराइड्स के लेवल हाई है, अगर आप हाई ब्लड प्रेशर के शिकार हैं, तो आप में चांसेस हैं कि आपको डायबिटीज होने की संभावना ज्यादा है। तो टाइम टू टाइम आप अपना चेकिंग कराएं, दैट विल बी बेटर। हम डायबिटीज के बारे में इतना क्यों स्केयर रहते हैं? इज इट अ सीरियस डिजीज? यस, एक्चुअली डायबिटीज कहने को तो एक बीमारी है, इट्स जस्ट अ वन सिंगल इलनेस। लेकिन अगर आप इसकी डिटेल्स में जाएं तो ये टॉप टू बॉटम आपके पूरे बॉडी के सारे ऑर्गन्स को अफेक्ट करती है। बॉडी का हार्डली ऐसा कोई ऑर्गन है जो इसकी हाई शुगर्स के एक्सपोजर से बचा रहता है। आप नाम लीजिए, आई, हार्ट, किडनी, स्किन, लंग्स, reproductive system, आपका sexual sex life, they all are affected by the diabetes. अगर हम कुछ कॉमन कॉजेज देखें तो डायबिटीज हमारे नॉट ओनली इन इंडिया, इन वर्ल्ड वाइड इज द लीडिंग कॉज ऑफ ब्लाइंडनेस। सोचिए, डायबिटीज कॉजिंग ब्लाइंडनेस, लीडिंग कॉज। नॉन ट्रोमेटिक एम्पुटेशंस, क्योंकि कोई अल्सर्स हो जाते हैं कभी कभी, तो नॉन ट्रोमेटिक एम्पुटेशंस का मोस्ट कॉमन लीडिंग कॉज है स्ट्रोक, लकवा, हार्ट अटैक, किडनी डैमेज। तो इन सब बीमारियों का लीडिंग कॉज आज के डेट में अगर हम कहें तो डायबिटीज है। इसलिए डायबिटीज को सीरियस शुरुआत से ही सीरियसली लेना बहुत जरूरी है। इसका अच्छा कंट्रोल शुरुआती स्टेज से ही अच्छा रखना बहुत जरूरी है। अगर हम मोटे तौर पे डिवाइड करें तो इसकी जो कॉम्प्लिकेशंस होती हैं डायबिटीज की, दो प्रकार से हो सकती हैं। एक्यूट कॉम्प्लिकेशन जो कि सडनली आती हैं, और दूसरा है क्रॉनिक कॉम्प्लिकेशंस। इसके बारे में हम आगे बात करेंगे। लॉन्ग टर्म क्रॉनिक कॉम्प्लिकेशंस में आती हैं डायबिटिक किडनी डिजीज, जी, किडनी की प्रॉब्लम जो कि शुगर, हाई शुगर, क्रॉनिकली हाई शुगर्स रहने की वजह से होती है। सेकेंड इज योर हार्ट अटैक। हार्ट अटैक भी कई बार डायबिटीज के मरीजों में अर्ली मैनिफेस्ट करते हैं, जो नॉर्मली हम 50, 55, 60 की एज में हार्ट अटैक देखते हैं, ये डायबिटिक के पेशेंट्स में 40 की एज में भी हार्ट अटैक की संभावना बढ़ जाती है। डायबिटिक न्यूरोपैथी, यानी कि डायबिटीज से जो नर्व्स डैमेज होता है, हमारी जो सेंसेशन, हाथ और पैरों में जो सेंसेशन फील करने के लिए जो नर्व्स हैं, पेन, टेम्परेचर सेंसेशन करने के लिए जो नर्व्स हैं, दे गेट ऑल्सो अफेक्टेड बाय द डायबिटीज। डायबिटिक आई डिसऑर्डर, जिसमें रेटिना का इन्वॉल्वमेंट मोस्ट कॉमन होता है, जिसकी वजह से कई बार सडन आई में हेमरेज हो सकती है और ब्लाइंडनेस भी आ सकती है। स्ट्रोक यानी कि पैरालिसिस। देन डेंटल इलनेसेस। डेंटल इलनेसेस एक बहुत ही इग्नोर्ड एरिया है डायबिटीज के पेशेंट्स में, हम अक्सर ध्यान नहीं देते हैं। इवन हम डेली प्रैक्टिस में भी इसके बारे में पेशेंट्स को कई बार एजुकेट करना भूल जाते हैं, लेकिन ये बहुत ही इंपॉर्टेंट एस्पेक्ट है, डेंटल इन्वॉल्वमेंट। डायबिटीज में दांतों का ध्यान रखना भी जरूरी है, जैसे हम बाकी ऑर्गन्स का ध्यान रखते हैं। इसके अलावा लास्ट है इरेक्टाइल डिसफंक्शन, यानी कि सेक्स से रिलेटेड होने वाली प्रॉब्लम, जिसको हम इरेक्टाइल डिसफंक्शन कहते हैं, बोथ मेल एंड फीमेल। इसको हम कैसे मैनेज करें? अगर हम इसके के डायबिटीज की केयर के को हम ब्रॉडली डिवाइड करें, एक बेसिक केयर एंड मैनेजमेंट है, जिसके तहत हमें अपना एक जनरल चेकअप टाइम टू टाइम कराते रहना चाहिए। जैसे मैंने कहा पहले, 30 ईयर्स के बाद, स्पेशली अगर आप ओबीज हैं तो अर्ली भी आप अपना डायबिटिक चेकअप करा सकते हैं, ताकि इस बीमारी को, इस कंडीशन को, इस इलनेस को हम अर्ली स्टेज पे पिकअप कर सके और अर्ली स्टेज से ही इसका कंट्रोल बेहतर कर सकें, ताकि आने वाली कॉम्प्लिकेशन, जो एक्सपेक्टेड कॉम्प्लिकेशन 15-20 साल में होती है, हम उसको और लेट कर सकें। अपने वजन पे शुरुआती स्टेज से ही कंट्रोल रखें, कोशिश करें आपका वजन, आप अपना रेगुलर एक्सरसाइजेस वगैरह करें, डाइट को डिसिप्लिन वे में लें, और अगर आप डायबिटिक के पेशेंट्स हैं तो रेगुलर डॉक्टर के विजिट के टच में रहें, क्योंकि ये डायबिटीज एक अपने में एक साइलेंट डिजीज रहती है। इसके आने के कोई लक्षण नहीं होते हैं, मरीज काफी लंबे समय तक बिना किसी लक्षण के भी हाई शुगर्स के ऊपर रहता है। इनफैक्ट कई बार ओपीडी में पेशेंट्स आते हैं, हम जब कभी रूटीन चेकअप कराते हैं या कोई कैंप लगा होता है, पेशेंट का सडनली शुगर 300-400 दिखता है, लेकिन पेशेंट से अगर हम पूछे कोई कंप्लेंट है तो पेशेंट कहते हैं कि कोई कंप्लेंट नहीं है। इसलिए इसी कारण ये कई बार डिनाइल मूड, पेशेंट डिनाइल मूड में भी रहते हैं और इग्नोर कर देते हैं शुगर के कंट्रोल को। इसलिए अगर आपको शुगर हाई है, आपको कोई सिम्टम्स भी नहीं है, तभी भी आपको उस चीज को ध्यान से रखना है, ध्यान से देखना है, डॉक्टर से कंसल्ट करना है, टाइम टू टाइम दवाइयाँ, और अपने हेल्दी लाइफस्टाइल को फोकस करके। मॉनिटरिंग एक बहुत ही इंपॉर्टेंट एस्पेक्ट है ब्लड शुगर के मैनेजमेंट का। अभी जैसे मैंने कहा कि आपके शरीर में अगर शुगर 350 भी है, तो कई बार वो बिना किसी लक्षणों के रहती है शरीर के अंदर में, लेकिन 350 शुगर आपके शरीर में किसी ना किसी ऑर्गन को जरूर डैमेज कर रही होगी। तो जब तक आप मॉनिटर नहीं करेंगे अपनी शुगर्स को, आप नहीं समझ पाएंगे कि आपकी शुगर्स कंट्रोल्ड है, अनकंट्रोल्ड है, बॉर्डरलाइन कंट्रोल्ड है। इसलिए मॉनिटरिंग करना जरूरी है, भले ही आपके शरीर में कोई लक्षण आए या ना आए। टाइम टू टाइम डिपेंड करता है आपको किस प्रकार की डायबिटीज है, कितनी खराब है। आप अपने डॉक्टर से डिस्कस कर सकते हैं कि आपको हफ्ते में कितनी बार या महीने में कितनी बार शुगर की मॉनिटरिंग, घर में शुगर की मॉनिटरिंग करनी है, नॉट द लैब वन जो हम हर 3 महीने या 6 महीने पे कराते हैं। घर में जो हम शुगर मॉनिटरिंग ग्लूकोमीटर से करते हैं, वो कितना फ्रिक्वेंटली करनी है, कितनी बार करनी है, कौन से मील पर फोकस करना है, ब्रेकफास्ट पे करना है, लंच पे करना है, डिनर पे करना है, ये सब आपको अपने डॉक्टर से डिस्कस करना है और उसी हिसाब से आपको उसको मॉनिटरिंग करना है। कई बार पेशेंट्स आते हैं कि हम तो मॉनिटरिंग करते हैं एवरीडे फास्टिंग शुगर, और वो कंट्रोल रहती है, लेकिन HbA1c उनका कई बार बढ़ा हुआ आता है। तो अगर आपकी फास्टिंग शुगर कंट्रोल है, तो इसका मतलब ये नहीं कि आपकी थ्रू आउट रेस्ट ऑफ द 24 आवर्स आल्सो शुगर इज कंट्रोल। उसके लिए आपको कभी कभी नाश्ते के बाद, कभी लंच के बाद, कभी डिनर के बाद भी शुगर्स को मॉनिटर करना। अपनी दवाइयों को, अपनी मेडिसिन को, इंसुलिन को रेगुलरली लेते रहें, जैसे आपके डॉक्टर्स ने आपको बताया गया है। वॉच आउट फॉर द लो शुगर्स एंड हाइपरग्लाइसीमिया, एंड इन केस ऑफ इमरजेंसी आपको पता होना चाहिए कि हु इज द राइट पर्सन टू कनेक्ट इमीडिएटली अगर आप किसी इमरजेंसी सिचुएशन में लैंड अप करते हैं। मूविंग फॉरवर्ड, लाइफस्टाइल के बारे में अगर हम बात करें, हाउ एंड नो व्हाट काइंड ऑफ लाइफस्टाइल चेंजेस दैट कैन हेल्प अ डायबिटिक पेशेंट। Lifestyle changes, when we talk, we mean to say by 2 or 3 major means. One is your walking, your the workout. Second is your diet, and second is your mental health. They are the three important component of the lifestyle changes. जब हम अपना लाइफस्टाइल चेंजेस करते हैं, तो ये विदाउट नीड ऑफ मेडिसिन, विदाउट नीड ऑफ शुगर इंसुलिन, ये हमारे बॉडी में शुगर्स को कंट्रोल करने में मदद करते हैं। ब्लड शुगर टारगेट रेंज में आना शुरू हो जाता है, कोलेस्ट्रॉल का प्रोफाइल बेटर होना शुरू होता है, जिसकी वजह से हमारे हार्ट हार्ट अटैक या स्ट्रोक के रिस्क कम हो जाते हैं। ब्लड वॉक करने से ब्लड प्रेशर भी स्टेबलाइज होता है, एंड डेफिनेटली हमारा मेंटल स्ट्रेस कम होता है, विच इज अ मेन वन ऑफ द मेजर फैक्टर फॉर इंक्रीजिंग द शुगर, स्पेशली इन द टुडे सिनेरियो। सो अगर हम अपने लाइफस्टाइल में चेंजेस करते हैं, तो हम इन सब चीज़ों में, ब्लड शुगर, कोलेस्ट्रॉल, ब्लड प्रेशर, अपनी मेंटल हेल्थ को इम्प्रूव कर सकते हैं विदाउट एनी नीड ऑफ शुगर मेडिसिन और दी or the any stress buster medications. And that's why there's an important role of lifestyle changes in our diabetic patients. तो अगर हम लाइफस्टाइल चेंजेस करते हैं, कुछ तो हमारे रिस्क फैक्टर्स होते हैं डायबिटीज में जो नॉन मॉडिफाइबल है, जिनको हम मॉडिफाई नहीं कर सकते। जैसे अब में हमारी एज है, जेंडर है, फैमिली हिस्ट्री है, अगर आपको पहले जेस्टेशनल डायबिटीज की हिस्ट्री थी, हमारी रेस, एथनिसिटी है, दे आर फ्यू फैक्टर्स विच वी कैन नॉट मॉडिफाई, but there are many other risk factors which can be modified. They are modifiable factors like high blood pressure, smoking habit, bad food habits, physical inactivity, our weight, obesity, high blood cholesterol. तो ये कुछ फैक्टर्स है जिनको अगर हम काम करें, जिन पर हम काम करें, उनको हम मॉडिफाई कर सकते हैं, और उनको मॉडिफाई करके हम अपने शुगर्स को बेहतर एक दिशा दे सकते हैं। So basically, there are 4 components: a balanced diet, physical activity, self-control, and the healthy social life. By following these you can control help they all these factors they can help you in controlling the blood sugar, blood pressure, blood cholesterol, and our mental health. And they are very easy to follow up if they require a very little efforts. But if you look at the level of benefit, they are tremendous. So very briefly, I'll be talking about a very dietary guidelines, not going into a detail of the diabetic diet. Just a few points that I want to highlight. Whenever you're going for a for diet changes in your, because you are diabetic and you're planning to go for the diet changes, try to opt for those lifestyle changes or those dietary pattern which you are able to follow for a long time. हम लोगों ने देखा है कि कई बार पेशेंट बिल्कुल क्रैश डाइट पे चले जाते हैं, ओनली टेकिंग ओनली फ्रूट्स, टेकिंग ओनली वेजिटेबल्स, टेकिंग ओनली प्रोटीन्स ओनली, और ओनली फैट्स की डाइट्स। ये सब डाइट्स आपका कुछ टाइम के लिए शॉर्ट गोल्स अचीव करने के लिए बहुत इंपॉर्टेंट इफेक्टिव है। 2 महीने में, 3 महीने में यू विल बी एबल टू लूज 5 kg, 10 kg। लेकिन आप इन डाइट्स को लॉन्ग टर्म के लिए फॉलो अप नहीं कर सकते, दे आर नॉन सस्टेनेबल। अल्टीमेटली जब भी हम अपनी दाल चावल रोटी वाली नॉर्मल डाइट पर आएंगे तो हमारा वेट बढ़ना ही बढ़ना है। तो कोशिश करिए आप ऐसी डाइट को फॉलो करें या ऐसे लाइफस्टाइल को फॉलो करें जो आप लॉन्ग टर्म कंसिस्टेंटली फॉलो कर सकें, ताकि जो आपने वेट लॉस किया है उसको भी आप मेंटेन सस्टेन कर सकें। ये बहुत इंपॉर्टेंट एस्पेक्ट है जब भी हम अपनी लाइफस्टाइल को बदलने के लिए शुरुआत करते हैं। डाइट में शुगर के पेशेंट्स में हम अक्सर ये बोलते हैं कि आपको फ्रीक्वेंट मील लेने हैं, और हम ये कहते हैं इसमें 3+3 का एक रूल है। 3+3 मीन्स 3 मेजर मील, ब्रेकफास्ट, लंच एंड डिनर। इन तीनों में से कोई भी चीज मिस नहीं करनी है, स्किप नहीं करनी है। तीसरा 3+3, अदर 3 इज 3 स्मॉल स्नैक्स। बीच बीच में छोटे छोटे कुछ कुछ मील्स खाने हैं। जब हम 3+3 मील कहते हैं, इसका मतलब ये नहीं है कि आप अपने 3 मेजर मील्स में कुछ भी खा सकते हैं। डाइट के साथ साथ हमें जो पैटर्न के साथ साथ हमें अपने टोटल कैलोरी इंटेक का भी ध्यान रखना है। तो अपने डॉक्टर से अपनी अपनी फिजिक के हिसाब से, अपने हाइट, बीएमआई के हिसाब से, अपनी बाकी कोमोर्बिड कंडीशन के हिसाब से आप अपनी डाइट की में कैलोरी इंटेक के बारे में डिस्कस करें। कोशिश करें उस कैलोरी को इक्वली डिस्ट्रीब्यूट करने के लिए थ्रू आउट दी 24 आवर्स। So 3 major meals, 3 minor meals are good for a diabetic patient. No skipping or missing of meal is advisable in a diabetic patient, especially if that person is on some insulin or on sugar medications. Don't skip your breakfast. Don't skip any of your snacks. Otherwise, there are chances your sugar may be very high or may be very low. Then drink a lot of water. 2 to 2.5 or 3 liters of water in a day is beneficial. Try to keep yourself hydrated well. So when we say a healthy, eating plan, as I said, it depends upon your height, weight, and BMI. Depends upon other comorbid condition. So one diet plan, one diet treatment cannot be generalized to everyone. Ideally, it should be customized according to the individual. Every individual need a separate diet plan. One diet plan cannot be generalized for the other. But let's see, whenever you are taking a healthy diet plan, they should include a lot of vegetables and fruits. Try to make your plate colorful. Try to add some green vegetables in that. Try to add some fruits in that. So whole grains and pulses are also very good. Don't take the refined flours. Avoid all those. The polished dals. Avoid all those. Try to increase your fat-free, low-fat milk or cheese or yogurts or other milk products in your plate. If you are non-vegetarian, you can go for the lean meat. Avoid any kind of red meat. You can opt for the poultry, fish, dry beans, eggs, and nuts also. Nuts are also very good, and there are some myths associated with the nuts, that the nuts increases the cholesterol or the sugars also. In fact, there are some studies which have shown that these nuts, they are very good in reducing the kind of a inflammation in our body, and that's why they reduce the cholesterol level also. So the nuts are very good. We should include at least 1 or 2 serving of nuts in our diet plan, and try to formulate your diet in such a way that it should contain all components, the fat, the proteins, as well as the carbohydrates also. There is a very misconception that when if you are diabetic, your carb should be cut to zero. No, in fact, zero carb diet is not good for any person, not for any person. So ideally, if I say a normal diet, a normal balanced diet, it should have a 50 to 60% of the carbs. The energy of the 50 to 60% of the total energy should be coming from the carbs. So in diabetic patient, if you want, you can make it around 45 or 50% or 45, 40%, but not below that. That could be very disastrous or bad for a diabetic patient who is on insulin or on oral hypoglycemic agents. So try, don't make the carbs zero. You can reduce the percentage from 50 to 60 to either 40 to 45%. Try then complex carbohydrates and the carbohydrates which have a low glycemic index or the low glycemic food are always good. Ask your doctor to calculate your and the total energy requirement based on your height, weight, and the activity level. If you look at the second component, the fat, the ideally a total calorie of a meal should be for 30% should be coming from the fat and the recommended oils. In fact, you can use there are various different types of oils I'll be mentioned in the slides, but one of the best is the mustard oil. The other is the olive oil. You can do the rotations also, or you can do the mixing of oils also. That is also good. But at the same time, if we are seeing the type of oil, at the same time we need to look at the amount of oil need to be taken. So two to three or three to four oil tablespoon oil per person per day. But it's very easy to understand. Like if try to keep the oil amount less than a half liter per person per month. So let's say if in your kitchen there are four people in your family and they are eating from the same kitchen, then ideally there should not be more than 2 liters of oil consumption in a month. So half liter per person per month is the ideal, and the type of oil you is mentioned on this slide, you can take it from there. Then protein. Again, protein is also important component of our diet plan, and ideally it is given according to the body weight. But again, it is affected by the other organ functions also. Like if you are having kidney issues, we sometimes reduce the protein intake also. If you are having a high uric acid, so there are certain parameters based on which the protein intake is modified. So you need to discuss all this with your doctors. The fiber content is also very important, which is the most neglected one in our diet plan. So ideally 25 to 40 grams of fiber should be there in our diet plan, which can be obtained from the fruits, vegetables. So you can keep around 3 servings of vegetables and 2 servings of fruits in a day. That can give you enough amount of fiber. Why the fiber is important in our diet? Because when we are taking fiber, the rate of glucose absorption, the whatever glucose we are taking or the carbs we are taking in food, they are absorbed in our blood. So the rate of absorption of these carbohydrates can be lower down if we are taking an adequate amount of fibers in our diet. So they are very important if you are having a sudden surge in your in your blood sugar after taking the meal. So these based on the glycemic index of a food, there are various. We can categorize these drug into the red food, yellow food, and the green food, just to make you people understand that which one is good, which one is not good, should be avoided. The healthy. So the red foods. If you want, you can take that in a very small amount. That is also occasionally, or we can say in a moderation. They are okay allowed. Sorry. And the food they have, because they are rich in sugar, they are rich in fat, they have a high glycemic index, and they have a low fiber content. So it should be given on occasion, taken on occasional basis only. Yellow food, which are just give you a minute, which are high in GI food, glycemic index food. They have a low fiber content and they have a moderate fats. They can be taken in moderation. The healthy choice is a green food, which has a low GI, high fiber, and low in fat content. Let's see some of the examples of these food items. If we look at the red zone, the fried rice, biryani, so you can go ahead. There's a long list of food items which comes under the red zone. Let's focus on the green zone. Ideally, a same kind of rice can be taken. Like rice, we are these days we are allowed in a diabetic patient, depending upon the scenario. But if you take them in the steam form, they will be good. The whole wheat breads are also good. Green salad, Try to take all kinds of, avoid the sauces because they have a lot of preservatives and all this. So though it is been included in the green zone, but they are usually should be home cooked without any preservatives. That's the important aspect of this green zone food. So what should be avoided? Avoid high calorie foods which are dense in calorie, like sugar, jams, fruit juices. Fruit juices are very important. Many of the diabetic patients they come and ask us कि हमने आज आपने तो संतरा बोला था हमने संतरा ना लेके संतरे का जूस ले लिया. But my sugars are going high. The reason being एक संतरा लेने में there are certain calories. But when you are taking a juice, एक cup juice के लिए you need 4 or 5 संतरा, oranges. So and you are removing the pulp also. So that's why your sugar goes up immediately. So avoid fruit juices. You can have the whole fruit that will give you added benefit of fibers also. So fruit juices, either homemade or the outside or the ready-mades, they are not allowed in a diabetic patient. They should be avoided. All kind of variety drinks, syrup-based drinks, energy drinks should be avoided by the diabetic patient. Avoid excess of consumption of alcohol. In moderation, we do allow, I'll talk about this later. Avoid saturated fat, trans fat in diet like processed cheese, butter, fried food items, chips, bakery products. They all contains a huge amount of saturated food that contains a lot of, the PUFAs which are not good, that should be avoided. And like palm oil based, all these chips, that are available in the market, all these processed food, they contain a lot of palm oil, which are saturated fat, not good for our health, so should be avoided. Not only for the diabetic, also for the other in general population also. And try not to lose weight following a crash diet. Go for the healthy, balanced diet after discussing it with your doctor. Moving forward with the exercise, as I mentioned before, this exercise helps your body to reduce to use this insulin effectively, and that's why your sugar goes down without increasing, without need of tablets or the insulin. They lowers the blood sugar, they reduces the risk of heart attack, lowers the cholesterol, helps in maintaining the blood pressure, reduces the body fat, and also help us to cope with stress. So there are multiple benefits of doing exercise. Now, which exercise and for how much exercise is very important. Always discuss with your doctor which kind of exercise is good for your health because, again, just like the diet, the exercise also cannot be generalized. I can't say run for 40 minutes for every patient. So it need to be customized according to the patient scenario, patient's other comorbid conditions based on the age, the physical activity level, and so ideally, when I'm talking about the diet, at least 40 to 45 minutes of a walk or daily physical activity in 5 days in a week is very important. If you do more, you will get the more benefit. But if I'm focusing for the weight loss, then 45-minute workout will not work. 45 workout minute of workout is good for the fitness point of view, but for the fat loss or the weight loss, we need more amount of workout. So what kind of exercises we can do? We can go for the walk, we can do the muscle strengthening exercises, the stretch exercises, then muscle strengthening exercises using small weights. Small weights means 1 or 2 kg, not more than that. Not like the we are using in the gym of heavy of 20 kg, 30 kg, 50 kg. No, 1 or 2 kg of dumbbells with stretch exercises also good. They provides a good strength to your muscles. And muscle strengthening is also a very important aspect for the workout part. So, one important point whenever you are going for a workout or the walk, always try to check your sugars. If your sugars are in a good range, you can go ahead. Otherwise, you need to take some kind of carbs or to avoid hypoglycemia during the workout time. Then stretch management, do some kind of meditation, yoga, to which can help in resting the stress also. Then smoking, there is no place of smoking in a diabetic patient that increases the risk of heart attack, stroke by 4 times. So there is no point of indulging in this kind of activities, not even a single one. Regarding alcohol and diabetes, so it should be avoided. But if someone is like if I talk the amount which is advised, which is can be given in a diabetic patient, 2 pegs, 60 ml twice a week is acceptable, not beyond that. So if you're taking this much, is fine. Uh, These are the list of tests that a diabetic patient should go ahead, depending upon the various comorbid conditions. Like every 3 months, go for your HbA1c. HbA1c is a test that tells us about the past 3 months average sugar control. And every annually, you should look for the any diabetic complications. Go for cholesterol, kidney function. Go for neuropathy checks. Go for urine to look for the leakage of proteins in your urine. Go for the eye checkup. So these are some tests which you should do it annually or according to the your illnesses, so that these complications can be picked up at the early stage. And once we pick them in an early stage, we can manage them in a better way as compared to when they are picked up at the late advanced stages. Then the management become a bit difficult. One more important aspect is traveling with the diabetes. Many a times, we when we travel, we usually indulge in the intake of a calorie-dense food. We avoid exercising and all. So there are few tips which you can follow while you are traveling. So before a long trip, get a medical test done to make sure that your diabetes is well controlled. If it is not controlled, then avoid long distance traveling. Get the immunization shots if not done, especially for the influenza and the pneumonias. Always carries a medical ID card with you, prescription, and the surplus amounts of diabetic medications, extra insulin cartridge, and the glucometer strips always along with you. Carry a hypoglycemic kit or the emergency kit along with you when the other medications for the minor illnesses like nausea, diarrhea, fever. You should always keep all these medications while traveling. When you are crossing the time, planning to crossing like going from one place where the time zone is crossed, then you need to discuss the adjustment of your insulin doses with your doctors. You should be aware of how to carry this insulin while traveling, because some storage packs are available. The what do you call that? The gel packs are available for the insulin, which in which the insulin can be kept at least for 48 to 72 hours. So you can use that if you are traveling for a long distance. Then footwear tips, very important. Wear a comfortable shoes. Avoid barefoot walking. Check your feet every day and get medical care at the first sign of inflammation or infection. अगर आप ट्रैवल कर रहे हैं और आपने देखा आपके पैरों में स्वेलिंग है, कुछ रेडनेस है, कोई इन्फेक्शन का पॉइंट दिख रहा है, then don't wait for to come back and then consult your doctor, because these kinds of infection can progress overnight. So if you are having noticing these kinds of features, discuss your doctor immediately. So here I stop my talk and I'll just invite if there is any query, and let me check in the chat box. I hope you people are get benefit from this. So there are some questions. Let me take them one by one. So from Piyush, uh, what is better for diabetes? The Piyush is asking what is better for diabetes, a rice or a wheat chapati? See, as I mentioned, sir, these days we don't, go too much that rice is avoid or not, or the wheat is good over the rice. It depends upon your sugar control. Like if someone is coming with to me and the sugars are very highly uncontrolled, 400, 500. In that scenario, even I ask the patient to avoid rice, right? Totally avoid rice, because that time the sugars are high. I need a tight control. But if someone is coming to me with a HbA1c of 6.5, 6.6, I'm allowing the rice they can have, but with some tips like take the use parboil, or the boiled rice in which the water is drained out. Then you can have the brown rice also. Take rice with a lot of fiber, vegetable, and high protein. Keep the amount of rice lower side. The same time, if the sugars is not controlled, I usually avoid that rice. So if you see wheat and chapati, both are equally good, sir. If your sugar is good control, try to keep them during the daytime. Avoid rice taking in the at the night time, because after taking the food we are usually in bed. So avoid using that time. And whenever you're in confusion, rice is good, because every individual behave differently, everybody. So you can do one trick also. You take the rice in your meal, and one day, and second day you take the wheat chapati. Then you can check your post meal sugars. If your body is accepting well, you can continue with the rice, and if not, then you just reduce the amount of your rice intake and follow the tips which I advised. Like take the water, you can have a brown rice also, or you can use the don't cook them in a pressure cooker. You just drain the water. That the cooking methods are also important when you are taking the rice. So moving forward to the second question, sir. How safe is artificial sugar like sugar free and is it better than jaggery? That's a very hot topic these days because the recent studies have shown that some of these artificial sugars, artificial sweeteners, they are not good. They increases the risk of heart attack. Still, there are some researches going on. So, if possible, there are many different categories of these artificial sweeteners are available there. If you say till we have the clear concept of these artificial sweeteners, you can go ahead. The safer one, which is available, stevia leaves, you can use for till we have the better results of the studies, and whether they are better than jaggery. Again, sir, jaggery, gur, khand, shakkar, sugar, they all belongs to the one category. They all contains a good amount of carbohydrates. So I'll not say that you can, if you are the sugar-free or contraindicated, you can take the jaggery. All kind of sugar contains sugar. The free sugars, the proper sugars should be avoided in a diabetic patient. If your sugars are controlled, good. Once in a while, you can have something made up of the jaggery, but not on the regular basis. Moving forward, the next question is precautions for the pre-diabetic persons or ways to reverse the pre-diabetes. As I mentioned, sir, this is a very, when if you're picked up in a pre-diabetic stage, it's a very golden phase of your, diabetes journey. Because if you put a little bit of efforts in your lifestyle changes, your dietary changes, your lifestyle, these pre-diabetes situations can be reverted to the normal. But at the same time, once you are reached in the normal stage, don't then you need to continue these kind of lifestyle changes because if you left them in between, you will again go back to the pre-diabetic stage. So you need to maintain a healthy lifestyle for a longer time. Sometimes what happens, we see then a very obese patient coming to us in a pre-diabetic stage. We do write some medications so that we know because patient is obese and sooner or later he or she will be developing diabetes, converting from pre-diabetes to diabetes. So we do give some kind of medications to prevent the development of pre-diabetes to diabetes that you can discuss with your doctor according to your scenario. In your scenario, whether they prefer the prefer any medications for prevention of conversion from pre-diabetes to diabetes, you can go ahead with that. And ways to reverse the okay, I have answered that question, sir. Then moving forward, next question from Mr. Sumit Kumar Singh. How to avoid diabetes if there is a family history of diabetes? Sir, as I said, there are some modifiable risk factors. We can't modify this risk that's inherited from your family, right? So, but at the same time, if you indulge yourself in a healthy lifestyle from the beginning, keep a check on your weight, do regular exercises, stress releasing. So these are few tips which can help you no in which can help you in maintain keeping a control on your weight, and that's why you can prevent the chance or delay the chance of developing diabetes in your later or the when you as you grow up. So that's the only the key to avoid development or not avoid to delay the development of diabetes if you are having a risk of the family history of diabetes. That's the only way of doing it. Otherwise, there is no medications, or we cannot modify the history of diabetes in the family, right? Moving forward, just wanted to know the symptoms and what should adopt it to stay away from the diabetes. As I mentioned, sir, diabetes sometimes, many times, in fact, diabetes is symptom free. Patients they do not have any symptoms, and now these days we are picking up these kinds of patients more frequently. Why? Because there is a trend of doing the health checkup during the MNCs and all. So these kind of people are picking up more early stages. So some many a times the diabetes does not cause any symptoms; it remains symptom free, and that's why we call it as a silent killer or silent disease. Otherwise, you can have very non-specific symptoms, which may not be pointed towards the presence of a high sugars in your body, like weakness, lethargy, drained out feeling. Then there are some specific symptoms which are which point towards the presence of a high sugars in your body are osmotic symptoms, meaning that you are having increased thirst, प्यास ज्यादा लग रही है, यूरिन ज्यादा हो रहा है, यूरिन वेट कम हो रहा है, देन यूरिन एरिया में कोई इन्फेक्शन हो रहा है, कोई वेजाइनल इन्फेक्शन हो रहा है, या बैलेनाइट पेनाइल एरिया में कोई इन्फेक्शन हो रहा है, कोई इन्फेक्शन हो रहा है तो वो हील नहीं हो रहा है और टेकिंग अ लॉन्ग टाइम फॉर हीलिंग. So these are certain specific symptoms which point towards the presence of a high sugars in your body. So if you are having all these symptoms, please go ahead straight to the lab and get yourself tested. And if you're not having all these symptoms, you are obese, you're having a high sedentary lifestyle, you have a family history of diabetes or pre-diabetes, then you should, and your age is more than 30, though there is no age bar these days, but you should check yourself for the blood sugar and to look whether you are diabetic or not. Then moving forward, next question is from Venkatesh. How to get rid of hypothyroid permanently once it is detected? So this is out of the syllabus question, but I answer your question, sir. Uh, Hypothyroidism, who said that it required a permanent treatment? All kind of hypothyroidism does not require permanent treatment. In fact, there are many different, patients of hypothyroidism which do not require the treatment. So it depends upon your values of the thyroid, how bad your thyroid function is. And then there are certain other tests, like we do a TPO antibody test and all, then your family history and all. Based on that, we decide whether you need treatment and you or you don't need treatment. If you don't need treatment, that's fair enough. If you need treatment, whether it required a long term or not, it depends upon certain blood tests also. Then it depends upon your severity of the thyroid test also. So it's not like that once you have started with the thyroid medications, everyone has to take it permanently. But majority of the patients, they need a long term treatment for the hypothyroid, especially if this thyroid medication has been started during the pregnancy state. Majority of our patients, we are able to stop these thyroid medications when the delivery is done. So it depends which type of thyroid, what are the severity of thyroid function test, what are the other parameters, blood tests related to the thyroid are there, and based on that we can decide whether you need a lifelong treatment or we can take a trial of fluiding it. So moving further, what would you suggest for meal if a patient has all three: diabetes, high BP, and thyroid? So, as I said, the single diet plan cannot be generalized to everyone. That needs to be customized. So, please discuss with your doctor. They would like to see your other parameters also: your height, your BMI, your weight, your family history, your cholesterol parameters, your kidney parameters. Because if I say, okay, you go for the 1200 diet calorie, maybe you are lean and thin, then the 1200 calorie will not work. But I'll say, okay, go for the 1400, you are lean, but maybe your kidney having some issues, your blood pressure is high. So we need to customize the diet chart. We cannot give one diet chart to all patients who are diabetic also, BP also, and thyroid also. In a BP patient, we do usually require the low salt intake. That's all. Thyroid does not require any modification. Thyroid, unless until you are in a habit of taking, raw vegetables, broccoli ले रहे हैं, cabbage ले रहे हैं, raw form में bowl भर के. In that situation, you need to avoid it. But all cooked vegetables can be taken safely in a thyroid patient. It's the list is getting longer. Is a diabetic and thyroids are related? If anyone has a diabetes, how far chances to get the thyroid disease? You're absolutely right, sir. Diabetes and thyroid are both related to each other, but the relations are is variable. Like if you are having a type 1 diabetes, type 1, which is usually seen in a young kids, if you're having a type 1 diabetes, which is an autoimmune disorder, then you are at a risk for developing other autoimmune disorder like thyroid disease, right? So in a patient who is type 1 diabetic, there is a high risk of developing the thyroid issues also. Then there is a other way relationship. If you are having a hypothyroidism, you are obese, your weight is too much, then you are again likely to develop the diabetes because of the weight. So both the disease are interconnected to each other. If you are hypothyroid, obese, weight, you are at a high risk for developing the diabetes. If you are having a type 1 diabetes, then also you are at a risk for developing the other autoimmune or the thyroid disorders. So this is a two-way link, thyroid and diabetes. Was it a single question or anything else was there? Okay, so Ajay Kadwal, how to keep type 2 diabetes in control? Sir, I have talked so much. Please, you need to check for your diet. You need to check for your lifestyle changes, the exercise part. You need to keep your medications, take your medications regularly. When you are taking a set of medications, look at the monitoring also, whether the set of medications are able to control your sugars or not. If you are taking some tablets and your sugar value targets are higher than that, then there is no point of continuing the medications. We need some kind of modification. Discuss your doctor. So whenever you are taking medications, continue the sugar monitoring also, because that is the only way of understanding, or that make you understand that the set of medication that you are taking is controlling your sugar. By and large, the blood sugar targets are variable for all different patients, but if I'll give you a very vague idea, fasting ideally should be between 100 to 130. If your sugar medicines are able to maintain that, you are doing good. Post meal should be from 130 to 160. This is a very general, vague idea. So if you are able to keep that post meal target okay with your medications, you can go ahead with your set of medications. So type 2 diabetic patient reduce their food consumption to maintain the blood glucose levels. So also, it's not true, sir. In a diabetic patient, fruits are also important aspect of the diet. So you can have a one or two serving of the fruit, but what type of fruit you are taking is important. That fruit should have a high fiber content and the glycemic index should be low. So these days, if you know whatever we are educating our patient, avoid 4 or 5 types of fruits like kela, chiku, anar, lychee. You avoid all these, but there are some studies going to be coming which which have shown on the preliminary data, which have shown that mango is also good, but again the moderation, the amount is very important. I'll give you example, sir. If you're taking a watermelon, I am allowing my patient, diabetic patient, to take watermelon. But what is the Indian tradition? Whenever we are eating a watermelon, we always, keep a big plate and a half more full of the watermelon. In that scenario, that is not good. So if you are taking a watermelon, you can have a 100 to 125 grams of watermelon is good. That will not increase your blood glucose very high. But at the same time, if you are increasing the amount, the portion size of that fruit, again, that is not good. So fruits are not that should be avoided. It should be taken one or two serving in a day is good for a diabetic patient, but the amount, the portion size is important. The next part of your question is, does the metformin cause skin allergies or the burning sensation? Uh, Metformin is a kind of a medication that sometimes hampers the absorption of one vitamin, which is B12. So if you're taking this metformin for a long time without any B12 supplements, your body B12 levels may go down, and that low vitamin D B12 can cause a burning sensation, numbness, paresthesias like situations in your hands and feet. So otherwise, it does not cause any the skin allergies. We haven't seen so much of skin allergies with the metformin, but yes, with the long-term use of metformin without any vitamin B12 supplement, some kind of burning sensation complaint we do after a long time. So always take some kind of B12 supplements whenever you are taking the metformin for a long time. Does eating rice contributes to diabetes? Not at all, sir. Not at all. It depends upon your workout, your physical activity, your BMI also. Like if I take if my hormone system is normal and I take a concentrated syrup sugar, my hormones will not allow glucose to appear in the blood till certain level. But if my hormone system is not normal, whatever sugar I'll take, that will be transported to the blood and my sugar will be high. So it depends upon your hormone system. If it is okay, fine, there is no point of avoiding it. How often do we need to check the level to prevent and delay in case they need insulin? There is no set criteria for this. Sir, we have seen diabetes of 2 years, 3 years requiring insulin. We have seen a diabetic of 25 years not requiring insulin. So there is no cut off for this. If you keeping your sugar good control, diet control from the beginning, then there are chances that your disease will progress slowly. And in that scenario, the requirement of insulin will be late. Okay. But if your sugars are not good control from the beginning, your sugars HbA1c 9, 10, 11 in the initial years of your diabetes, then in that scenario your diabetes progression, the disease, the graph will progress very fast. So you will develop the early complication. You will need insulin early. So it totally depends upon your efforts, how religiously you are following the doctor's advice, your diet, how religiously you're following diet, exercise, how good you are keeping your under control. It all depends on that the insulin requirement will be there. Otherwise, your doctor can, they can judge or they can assess the need of insulin depending upon the various tests also that you can discuss with your doctor. Then I think this is the last question. Even with a lot of medication, diabetes is still can't be cured. Just it is prolonging. Why? What is your suggestion to get rid of it? Sir, this is the last question, and I think I have answered many times about this. As I said, sir, it's a chronic illness, right? There is no cure for diabetes. We need to manage it for a long time. Especially if you are in an early stage of diabetes, your diabetes is because of your body fat, your obesity. If you lose certain amount of fat or weight, then this diabetes can be reverted. But at the same time, if you regain that weight again, it will reappear again, right? So you need to do the lifestyle changes. You need to control your body for consistently. It's not like a for 3 months if you do it and your diabetes reverse, you are now diabetic free. You are still at a risk for diabetes. So once you get the tapa of diabetes, your diabetes remain diabetic for lifelong. Whether it is controlled with diet, your exercise, or with your medication is a different one, right? So if you was diabetic and now you are diabetic free, but still you are a diabetic patient, control on diet and exercise. That need to be remembered, sir. Diabetes free doesn't mean that now you can eat or have a leisure kind of lifestyle. That cannot be done, sir. If you are diabetic from a couple of years recent, can you reverse diabetes and have a normal lifestyle? Yes, as I mentioned, just said Soumya, if you are in early stage of diabetes, obese, lose weight, yes, you can reverse your diabetes, but this reversal needs a maintenance of the same kind of lifestyle. If you go back to your previous one, you will again develop the diabetes. So you need to maintain that lifestyle for a longer time. Okay, so no more query. Thank you. I hope this session was helpful to you. So I'll now log out. Thank you. Thank you for the patientful listening.